We're joined now by the person in charge of Madhya Pradesh's health department, Suleiman. And of course, as the news item suggests, that Madhya Pradesh is one of the areas which is hit hardest. Mr. Suleiman, thank you so much for speaking to Hindustan Times at such a crucial hour. I'm sure you're very busy, sir. But just to explain, one thing that's right on top of my mind and on the mind of various people is Principal Secretary Health. Her son had traveled abroad. Isn't it true that that the fact that she continued to work, that has been seen as irresponsible behavior, that is how it spread to so many other officials, sir? This is no blame game that we are doing, but it's just that it's the reason why people are tracking people. It's to keep everyone safe. So would you acknowledge that the Principal Secretary Health's, in retrospect, it was irresponsible?
Just the reverse of it. Principal Secretary Health is a mother and a wonderful officer, extremely hardworking and sincere. It's a fact that her son traveled from US. When he came here, there was absolutely no advisory as far as the US was concerned. Still, that boy was careful to be in self quarantine in our own home, continued to be there. I would also let you know, and I'm extremely happy about it. Though the Principal Secretary Health tested positive, her son and her husband living in the same house have tested negative. So there is nothing that you can blame. One can blame the family or anything. It's a fact that she contacted the virus, but like many others, the problem is from the office, not from on the personal front. And I also want to say this, that when somebody is onto this battle head on all the time, working 16 hours a day, in hindsight, one can say that you could have been more careful, you should have been more appropriately responding and everything. But if you recall, in those days, they were just the beginning of the virus in India, and there was very little awareness of the dangers that it can pose. So one might say that being functioning from a single office may not have been a good idea, and they should have been talking on VC. But that's the only thing that one can say. Otherwise, there is absolutely nothing that she was not doing. And in fact, I mean, to her dedication, I would say this: even after testing positive, though she's completely asymptomatic in a hospital right now, still on a video call, she's available 24 hours, 24 by 7. Whenever I need something from her past experience, I still call her up. She's still talking to the field staff whenever there's some guidance is concerned. So you need to appreciate the dedication of an individual, that she still continues to work.
Of course. And, I just think it's so ironic that in Madhya Pradesh, all of you who are corona fighters, so many people, they've been impacted themselves. How many people, sir, what is the official figure within the department are ill?
I would say within the department, but I would say that the multi-department team, which was looking after the corona challenge, that includes medical education and health. So a total of about 90, including the family members and their contacts, have tested positive and have been taken care of. And I am so happy to also say that all of them, fortunately for us, are not in a serious condition. Most of them don't have symptoms. Rest of them are comfortable. None of them have gone to ICU. In fact, I'm expecting few of them to be discharged in a day or two.
And you took over in the middle of all this?
I won't. Okay, just a bit of modification. As working in the government, we don't really work in silos. We work with each other. So I was coordinating the certain activities of health department even before I took over. In fact, Chief Minister had asked all the senior officers to all involve themselves to create a second line of command wherever needed, to create guidance mechanism wherever needed, to create institutions for cross-department coordination wherever it was needed. And I was already associated with the health department, working closely with them, trying to organize their testing capacity augmentation. Just that when she had to be admitted in the hospital, I'm working on it full-time basis.
I just wanted to ask you, the figures seem really worrying, sir. You've had a rise of almost 300 in just a single day. It seems that the death rate also is higher in Madhya Pradesh, and Indore has been particularly hit. Why is that? Why do you think this is happening? And what do you have in place to fix this? We're all learning from it every day. So this is a new situation to deal with.
You said three things in one sentence, and the answer lies within those three things. On somewhere you said that the death rate is high. So the reason is very simple. If we don't test the people and then put them in hospitals and don't treat them, obviously the persons testing positive and putting into hospital versus death statistics would say that it will become very high. In fact, when I took over, we were reporting a death rate of around 12%. But as we ramped up our capacity, now it has come down to 4.7%. And it's just a statistics, nothing more. So I won't really go into it. There are different reasons for that. And in fact, just to share one data with you to put things in perspective, not to say, every single death is a serious concern and why we should, look at the numbers that way. Every death is important. I tried to analyze the death in Indore, and I found out that average hospital stay for the persons who have died is only 3.5 days. That would actually mean they reached the hospital at a very advanced stage of infection, and very little could be done to save them. And why they reached so late is simply because they tested very late. They came to know of the infection very late. There is another example in Bhopal, Chirayu Hospital. I have 218 patients. Not a single of them have died because they reached the hospital much before it could become serious. So the challenge was that how do we test them quickly and how do we take them to the hospitals quickly. The number of positive has increased because we have ramped up our testing capacity and we have ramped up our testing numbers. Initially, in fact, our first case reported were on 24th of March in Indore. No status modeling would prove rise from 4 to 900 in a very brief period of time. In fact, 24th March to 17th of April. All my statistical data would only say that when I tested 4 positive, that means I had many more guys who were positive and they were not being tested. We only had 150 testing capacity, which we have now ramped up to about 1400. By the end of this month, it should be around 2000. In fact, in Indore itself, we have tested 5,000 people. In those days when these figures was going up, we had ramped up our testing from 200 for Indore to about 1,000 in a day. And I didn't have the lab capacity to test them in Madhya Pradesh. I've flown my sample right up to Delhi in a charter to get people tested in an advanced stage.
Wow.
In fact, day before yesterday, I sent a plane load of test kits from Bhopal. Today again, I'm sending test kits from Bhopal to Indore. See, the key to combat this challenge is to identify people in advance, test them, and then treat them. If we can locate these patients in advance, test them, and then treat them, it's always possible to get them treated. But once it becomes late, it's really very difficult to help those individuals. So we have ramped up hugely our testing capacity, our sampling capacity, and that shows in the number of positive results also. I'm not really worried about the number of positive results. Even if these numbers would not happen, these guys were in any case infected. So what is the point of hiding the infection? I thought I must test them and put them to hospitals as soon as I can.
Well, that's wonderful. And in fact, everyone says that's the key, really, to ramp up testing, even if the numbers are worrying. And that's really key. So that's great, sir. Final question, sir. Across the country, I know that this may be a difficult one, but across the country, people were horrified to see a lot of people getting together and those visuals. One was, of course, Nizamuddin, but the other one was also political developments in Madhya Pradesh, where you saw lots of people together at a time when they were supposed to practice social distancing. And some religious places also. I think Ujjain's temple may have been open. In retrospect, do you think that things could have just been different and people should have just been stricter? They were strict in Rajasthan, but perhaps Madhya Pradesh could have been stricter.
Why put a political questions to me? I am not the right person to deal with political issues.
Okay, sir. Okay, I understand. Thank you so much, sir. Good luck with everything. Thanks very much.
Very nice talking to you. Very sweet of you. Thank you.